Suzanne Somers is perhaps best known for her acting career and more recently for her controversial position on hormone therapy.
But now Somers is making medical headlines again, becoming one of the first women in this country to undergo experimental breast reconstruction surgery using stem cells. Could it be an option for women after a lumpectomy? Dr. Sapna Parikh here now to explain. Sapna.
Well, this procedure involves using your own fat cells to reconstruct your breast. It could be an option if we see that it's safe in the long term, but we do not know that yet.
Come and knock on our door.
Suzanne Somers shot to stardom as a TV sitcom actress. In 2001, she announced she had breast cancer. And now, a decade later, she's among the first in the U.S. to try an experimental breast reconstruction surgery using stem cells, sharing her story with ABC's Juju Chang.
This is the first clinical trial. So I was the first woman to legally regrow her breast using stem cells.
The procedure is called cell-assisted lipotransfer. Fat is sucked out of the stomach. Half is harvested for stem cells, which are then added back to the remaining half and re-injected into the breast. Suzanne says 12 years ago, a lumpectomy and radiation left her breasts lopsided.
This clinical trial that I started, after completion, will make this subject to being FDA approved and paid for by insurance.
But critics say that depends on the results. Researchers from the University of Tokyo have tested cell-assisted lipotransfer in hundreds of women in Japan for cosmetic breast enlargement. But the long-term outcome and side effects of the procedure are still unknown. But Suzanne Somers is not one to hide from controversy. On top of daily human growth hormone injections, she also takes up to 90 supplements a day.
I take estrogen, progesterone. I just recently added in testosterone.
Only time will tell if her latest experiment with breast surgery will prove to be successful or not. So there are some big unanswered questions. Will the new cells survive? Is there enough blood supply? Will the injected stem cells reprogram themselves and become cancer cells? And how will the breast look down the road in terms of the shape? So there are a lot of unknowns.